What's up, everyone? Welcome back to the Daily Sean. For those of you who haven't been here before, my name is Sean. I do a daily video on something related to nursing. No rhyme or reason. Probably not going to change. You're going to have to learn how to lie. Sorry. If I'm the first one that has told you this, sorry to break the bad news to you. As a nurse, you're going to have to learn how to lie. I thought of 3 times in my nursing world as a bedside nurse. Once again, I'm a nurse practitioner now. 3 times where I know I've had to lie to my patients to either delay a process or to give them comfort in a moment of need. I don't want you to think that we lie to deceive, or that we lie to misdirect, or that we lie because we simply don't know. We lie to help our patients in some strange way, or to help bridge them to another step. But a lie is a lie is a lie is a lie. You're going to have to learn to develop the straight poker face. You're going to have to go from to being able to give the poker face regardless of what's going on. 3 times where you're going to have to learn how to lie. Number 1. You're going to have to lie when the patient, family, friends, or visitors are asking for a specific diagnostic result. In our world, as a bedside nurse, it's not your responsibility, or is it within your scope of practice to give diagnosis. So you probably could read a report to the individual, but then they're going to ask questions about what does that mean, what does this mean, diagnosis and things like that. And as a bedside nurse, there are going to be instances where you're not going to have that answer. So giving them a diagnosis and not being able to expand on that concept is kind of torturous to a patient, family, friends, visitors. So we have been directed as bedside nurses to not give that information and to get a provider so that the provider can give them that information. Me, physician, a physician assistant, you get the point. Unfortunately, you're going to have to lie sometimes to the patient's family, friends, visitors, and say that that report hasn't come back yet. Case in point, a scan of some sort comes back with a life-altering diagnosis that has to be told by a physician or a provider. You're going to want to let them do that, because that family, friend, visitor, patient are going to have a lot of questions. And you also need to navigate through the murky waters of who's allowed to have that information and who's not allowed to have that information. And at the end of the day, whether we all like it or not, the physician is the end all. They are the one that has their name on the chart. They are ultimately responsible for everything that goes on with the patient. Whether we like to accept that or not, that is the law. Number 2, second time you're going to have to look a patient straight-faced and lie to them is in that moment of crisis when the patient is truly knocking on death's door. And they look you dead in the face and ask you if they're dying. You can't tell them they're not dying because you don't have that ability. You can say with a good bit of confidence that you're doing everything in your power to prevent that. That you and the medical team are doing everything to prevent that. But when your patient is ultimately knocking on death's door, it is not appropriate to tell them, why, yes, you're dying. Because you don't actually know that for sure. And most of the time, if a patient truly is dying, you don't get a chance to actually tell them that. Very rarely do we actually get to say that out loud. Few instances that we're not going to we're not going to go into the details of that. But you're going to have to be straight-faced with them and give them some piece of positive information when there isn't any. And number 3, third time you're going to have to give the poker face, straight up lie to them is when the patient asks you, have you done this before? Why, yes, I've done this a dozen times. Gonna have to give the McDonald's face, because guess what? There's gonna come a moment in your career when you're gonna perform a duty, a skill, a responsibility that you have never physically done on a human being. You may have practiced it, you may have had competencies, you may have done return demonstrations on dummies and mannequins and live scenarios, but that first time that you as a healthcare provider, practitioner, bedside nurse, or anyone else, there will be that first. There will be that patient who is your first. Your first IV stick, your first Foley catheter placement, your first NG. The first time that you have to assist with a central line. The list is endless. Same thing for me as a practitioner. First time I had to intubate someone. First time I had to put a central line in. Need I say more? You're going to have that first patient. And that first patient, you're going to have to flat out lie to and say, you know what? I have done this before. You don't want to tell them you haven't, because then they are not going to have the confidence in your abilities, which can cause a cascading effect with a bazillion other things, the least of which is their stress level is going to go through the roof. They may shimmy, they may shake, they could do something to prevent the procedure from happening in a smooth manner. The list is endless. Once again, you're telling them a flat-out lie to improve the situation. I am by no means promoting the idea of misdirection or misleading or false information. There are a handful of times when we as the nurse, as the provider, are going to have to give our patients, family, friends, visitors a sense of comfort. You're going to have to be that blanket. You're going to have to be that piece of familiarity. You're going to have to be the comforting entity throughout that process, whatever that process is. And part of the comfort is to lie to them, whether you like it or not. Curious to hear what you got to say about this one. Leave your comment down below. You know your comments are my caffeine. Share this with somebody. And as always, check your own pulse first.